pharmaceutical industry is founded on the premise that our scientists will identify drugs through a long, laborious 15-year period of research and development and spending lots of cash, maybe 800 to 1 billion US dollars to discover one drug, and we have many failures. And when we do discover that drug, we are allowed a patent period of about 8 to 15 years, where we are the only people allowed to manufacture and sell that drug. And of course, we priced it fairly well, so that we recouped our investment and made some profit for our shareholders. That was the foundation of the pharmaceutical industry, and has been for a long time. Having said that, about 20 years ago, because of HIV/AIDS and the challenges posed by the disease, particularly in the developing countries of Africa, that model was challenged substantially. GlaxoSmithKline then was the biggest pharmaceutical company in HIV. We were the leading company. We were hoping to make lots of money from HIV. But society came back and said, it is not feasible for a company to make super profits from a disease that's afflicting 40 million people in Africa. And therefore, our model was challenged. And that was the beginning of true change in terms of the way pharmaceutical companies viewed Africa. Pharmaceutical companies invested in Africa. And so we started seeing change, and the industry started saying, what do we do differently in Africa? Because our traditional model works very well for the Western world, for the developed world, but not for Africa and the developing world. So the first thing we saw there was, if I speak to GSK, we agreed to give voluntary licenses for all our ARV medicines and allowed third parties to manufacture them, and we gave away our patents, and therefore our revenue source. And that pricing model has been replicated by others in the industry. We now have tiered pricing models where many companies, including my company GSK, or the company I work for, have tiered pricing where we look at pricing in the developed world, pricing in middle-income countries, and pricing in the developing countries. So if you went to pick a GSK product today, an innovator brand, a product that we've discovered recently, the prices today are 25% of the price you find in Europe and America.